Well, good morning. And I'm Ken Moore. I'm the mayor of Franklin and founder of Find Hope Franklin. And I want to welcome you to Find Hope Franklin's conference, Together We Can Find Hope. Your interest in community health is appreciated, and particularly the mental health of our community. Find Hope Franklin was founded by community leaders, mental health professionals, and clergy in order to raise awareness of mental health and that it's a permissible topic for people to talk about. And also to train our community in suicide prevention, so-called Question, Persuade, Refer, QPR. And also to create a website with the best resources for our citizens and long-term look to establish a crisis stabilization unit in our community. This initiative today is to raise awareness in our community and continue getting the discussion going. Some caution, this subject matter we will be considering today could possibly trigger some unexpected emotions among our attendees, and we have made arrangements to have a room where people could go and a health professional will be there in that room, and that room is 24. So we'll have people out there that would direct you if that's necessary. Several people I need to quickly thank. Number one, the students that have been directing you into the room. They're part of the program here, and they're earning credit hours for volunteering today. Our exhibitors, Bob Trubisky, who's there running the soundboard and been very instrumental in helping us plan the logistics here. Mary Beth Challey, wherever Mary Beth is, she's been great to work with. And then Melissa Ryerson from my staff and her communications team, and then Dr. Lampley. And I probably left out a lot of people, so my apologies to them. We're honored to be guests of our community college this morning in the new auditorium that was recently opened. With us today is Dr. Janet Smith. She's the fourth president of the Columbia State Community College. She assumed that position in 2008, and to her credit, she has been the leadership in developing not only the Columbia campus and the other campuses in the system, but particularly the Franklin campus where you are today. She's a Tennessee native. She grew up in Houston County near Erin, Tennessee. She has an impressive educational background, which I won't go into, but one thing that's always gotten my attention about Dr. Smith is that she has a passion, you won't guess it, muscle cars. So join me in giving her a warm welcome. Dr. Smith.
Good morning. How is everyone today? You ready for a wonderful day of learning and becoming more acquainted with what's going on in our community, I hope. It's my pleasure to welcome each of you to Columbia State. Always a pleasure to have Dr. Moore here, and to Dr. Frist, have him here as well. I know you're going to have an exciting, a very good time as he provides the information that he's going to bring forward. Such a person who is so knowledgeable, and I think will share with us some information that will help each of us in our own work and in our own lives. You know, mental health is an issue that years ago no one talked about. It was hid at home in families, but that's changed. Probably hasn't changed as much as it needs to be, but it has changed. And it's made up of a lot of different aspects, different issues, whether and it has ancillary problems that go along with it, whether it's an alcohol or drug that goes with the mental health, or whether it is getting the proper treatment and care. And I think today it's going to pull all of those things together and talk about what are some of the issues around mental health, how can we as a group, as an individual, promote health care, particularly mental health care. Again, it's my pleasure to have you here. It's my pleasure to welcome and to applaud our organizers for putting today on, and applaud you for taking a little bit of your time to come and to learn and to share and to build a partnership. I think that Finding Hope is a wonderful, wonderful title for a program like today, because it is about finding hope to help those who feel that their hope is gone, finding hope within our own hearts that we can make this world a better place for every individual, and particularly those who are having health problems. So pleased you're here today. If you have any issues, any concerns, or you need some assistance while you're on campus, there's several of us around. Please don't hesitate to ask. Thank you. Thank you all for coming today.
Well, it's my honor to introduce our first speaker of the day. Senator Bill Frist, MD, is the chair of the Nature Conservancy Global Board of Directors. He's a nationally acclaimed heart and lung transplant surgeon, and former U.S. Senate Majority Leader, founding partner of Frist-Cressey Ventures, and chairman of the Executive Council of the health services investment firm Cressey & Company. To say he's actively engaged in the business as well as the medical, humanitarian, philanthropic communities is an understatement. He's a major leader in that initiative. He's a founder and chairman of SCORE, a statewide education reform organization that has helped propel Tennessee to prominence as far as K-12 education reform, the Global Health and nonprofit Hope Through Healing Hands and Regional Community Health Collaborative. So if you'll join me in giving Senator Dr. Bill Frist a warm welcome this morning.
Awesome. Thank you. Mr. Mayor, thank you, and it's a real honor, and I say this with all sincerity, to be able to get things kicked off for what is going to be a really, truly fascinating day that we'll all learn from, that will provoke thoughts and solutions. We'll end with the real hope which is out there, and I'll end my opening remarks with that hope as well. Dr. Smith, what a tremendous facility, obviously, that we're enjoying today, this room, and the mayor and I had a chance to walk outside a little bit as well, but also what it represents, the students that are here, that come here, that enter the portals that we just walked through, and then leave better educated, more knowledge, wiser. And thanks for you and all the staff and the students who are here for making that possible. I live in Williamson County. This is my county. Don't live too far from here, coming through on a farm, and have lived here for about 12 years and grew up in neighboring Davidson County, and was there yesterday, and I was thinking about the importance of what we're talking about today and the commitment of so many of you, both in the short term and the midterm and the long term, to an issue that's lifted up so that we can discuss, we can think about, we can project ahead, we can figure out what we can do. And I was at a conference yesterday morning, and at that conference, we were talking about how to lift up Davidson County, and we were talking about housing and all the many social issues that were out there. But it kept coming back again and again to the daily stressors of life. Things like transportation and things like housing and the burden of extreme heat, this sort of newer phenomenon over the last decade that's getting worse and worse. And all of these were looked at through the prism of how it affects our physical health as well as our mental health. And one thing, there are a whole bunch of things that came through, but one thing that was really interesting to me as a physician, but I could also see that it resonated with everybody, is talking about something as simple as pollution. The air that we breathe in every day, those gases and what's ever in those gases, how clean or how dirty, have an impact in the airways of our lungs, these little things called alveoli of our lungs, and they immediately cause an irritation of those alveoli. And then these pollution, these little tiny little particles end up getting into the bloodstream, and it affects your blood vessels, all the blood vessels throughout your body, and it makes them hyperreactive. It makes them inflamed and angry. And if you have little calcium plaques, that angriness lifts these plaques up and causes heart attacks and causes strokes. And these little tiny particles that are just in the air that we're breathing right now, everywhere, that come in, and it especially applies with pollution, which is aggravated by climate change, then will travel up to the brain itself. And then the brain causes that same sort of angry, red inflammation that we all experience elsewhere in our body, and that causes anxiety, and it causes depression. And if you're on an antidepressant today, in truth, what you're taking is an anti-inflammatory medicine. I kind of open with that because it kind of pulls things together, how our environment physiologically affects us, how it affects us with this interaction between the physical and the mental of our brain, our anxiety, the stressors of everyday life. My job today really is an easy one, probably the easiest, because it's mainly the scene setting for everything that we'll be talking about over the next several hours, and what terrific panels have been laid out to have a discussion, an open discussion on this topic. Our nation is facing a mental health crisis, a crisis that we talk about, that we elevated in today's discussion to really bring people to the table. 1 in 4 Americans experienced a mental illness of some sort in the past year. That's 60 million Americans. About 1 out of 5, or 18%, of all adults had a substance use disorder in the past year. 1 out of 5. The vast majority of them, we'll talk about it later, did not receive any treatment. Suicide mortality is at a record high. The number of individuals who died by suicide in 2022, a year and a half ago, reported, was the highest number ever recorded in the United States. There are lots of ways of looking at sort of the mental health crisis. But if we look at the area, in my mind, we can look at the sort of 3 different areas. One is the youth mental health crisis, and that's highlighted in an advisory from the Surgeon General. There is a crisis around serious mental illnesses. All are serious, but by that I mean things like schizophrenia and bipolar disorder, contributing to social problems, including to homelessness and contributing to incarceration. And then there's the ongoing substance use disorder or addiction crisis. We'll be talking about that, fueled by prescription opiates such as OxyContin, but complicated by new lethal drugs that we just didn't see 5-10 years ago, such as fentanyl. So the real question is why? And with any sort of public health issue, you want to go back to the root causes. And to get back to the root causes, you do have to ask the question why. And as we all know, there is no single answer. There is no single sort of thing. It's caused by multiple factors. So let's take a look at what those are. And I'll go through several here. And first would be this whole area of a lack of connectedness and an epidemic of loneliness. Extensive scientific findings show that social connection is a significant predictor of longevity and better physical health, better cognitive health, better mental health. Now, the other side, or the flip side of that coin, is social isolation and loneliness are significant predictors of premature death and poor health. In fact, the mortality impact of being socially disconnected is similar to that as caused by, and this is sort of an equivalence, a way of thinking about it, 15 cigarettes a day. The sort of equal impact in terms of that mortality impact. Bowling Alone, published in about 24 years ago, in 2000, I believe, at the turn of the century, captured then groundbreaking research showing how social bonds, the way we relate, the way we interact with each other in a social setting, are the most powerful predictor of life satisfaction. And it, at that time, 2000, sounded the alarm on the deterioration of the social fabric of our nation. In-person interactions had begun and are continuing to be replaced by what we all know, the digital communications we all rely upon every day. Fewer Americans are engaging in that sort of interpersonal, that social interaction. Fewer people are engaging civically in community structures that many of us grew up with and a part of our lives really up until 20, 25 years ago. Things like the PTA or church or clubs or political parties or, yes, bowling leagues. And then the pandemic came, and the pandemic supercharged these feelings of isolation. So much so that the U.S. Surgeon General actually released and issued his advisory on the loneliness epidemic last year. The rise of social media. How many of you use social media right now? I mean, everybody's hands go up. And clearly we see the benefits of that, the efficiency, the productivity, the keeping in touch. Social media can help distant friends stay in touch and family members from afar stay in touch, connect individuals who have shared interests or going through shared experiences in lives. But now the science is coming out and we're really learning the impact of growing up with social media. Up to 95% of youth ages 13 to 17 report using a social media platform, and more than a third say they're on that social media platform using social media constantly throughout the day. How many in this room are worried now about the effects of social media on children and adolescents today? And again, the hands are up. We need the science, and we're accumulating the science of what that actual does to the brain, to the hookups of the brain, to these neural networks that are developing at this very malleable time of life, of adolescence going up to the early 20s itself. There's a period when mental health challenges such as depression typically emerge when you look at these earlier years from 10 to about 19 years of age. There's a highly sensitive period of brain development. It's especially susceptible to the social pressures, to what people are thinking of you or you think they're thinking of you, to peer opinions. Now, all this happens, as a physician, I tend to go straight to, as you can see in my opening remarks, straight to the brain and the physiology. And indeed, we know a huge amount. It's in the amygdala, sort of in the middle of the skull itself, that part of the brain, and in this prefrontal cortex that we know is being constantly rewired by these experiences that you have when you're using digital media. Adolescent social media use is predictive today, statistically predictive of a subsequent decrease in life satisfaction for certain developmental stages, including for girls 11 to 13 years of age, and from boys from 14 to 15 years of age. Third, despite a significant and measurable drop in violent crime, Americans feel less safe as we look at these sort of continue to look at these external and environmental threats. A Gallup poll released in November 2023, more than 3/4 of Americans believe there's more crime in the country than there was last year in 2022, even though 2023 featured one of the lowest rates of violent crime in the United States in more than 50 years. It's that perception. That's what we feel, but that perception becomes a reality when it affects us physiologically and our mental and behavioral state. 40% are afraid to walk alone at night near home. That's the highest. That figure has been measured over 3 decades, and that fear of walking alone is higher than it's been in 4 decades. Third, as I look at these external environmental threats, in the last 15 years, there's a lot of macro external stressors that are magnified by this continual, ongoing, 24/7 media cycle. Remember, in 2008, we had the Great Recession, a huge financial impact and a financial threat for those people who were not impacted. Within a year, firearms became the leading cause of death for children and adolescents in Tennessee, a threat to personal safety. And in 2020, the COVID-19 pandemic, a threat that we all lived through, that we felt it continues to have an impact today. Increasing extreme weather events is a third factor that, increasingly we sort of see and are made aware of, and It was just at the end of September, Hurricane Helene, the Category 4 storm. It struck the United States, leaving hundreds of people dead, causing over $30 billion in damage. And right on the heels of that, we had Hurricane Milton, followed as a Category 3. And despite being weaker and then anticipated, the devastation was significant, as we all know, ultimately with 17 people left dead. Storms of this magnitude haven't always been the regular occurrence. Statistically, over a 50-year period from 1972 to 2022, the last 50 years, only nine Category 4 or 5 hurricanes struck the United States. However, 6 of those occurred just in the last 6 years. This increasing frequency of unstable weather patterns. We see it with the hotter days that we felt here in Middle Tennessee and indeed around the country and indeed around the planet, the hottest in recorded history. And that is going to continue as we move forward. Climate-related disasters, whether it's the hurricanes or the wildfires that are so vivid in recent memory earlier this year in the last 2 or 3 years, the floods all have a massive toll on our mental well-being. What do they lead to? They lead to stress, they lead to anxiety, they lead to depression, they lead to emotional trauma. Fourth, future fears. This whole climate sort of what's called catastrophizing, so catastrophizing. So it's anxiety about the future. Where are we going? I mean, the trends that we just said, the hurricanes are getting worse, the unstable weather patterns are getting worse, the heat is getting worse, they're causing the stress now. What is that impact it's going to have on the future? A recent survey by the American Psychiatric Association found that the majority, over 50% of our younger generations, and this is sort of 18 to 34 years of age, said climate change does impact their mental health. More than half of Americans are anxious about the way government is currently responding and dealing with climate change and its potential impact, including 1/5 who say they are not just anxious, but very anxious about it. Generation Z, born between the mid-1990s and 2010, sometimes seem to see themselves as a doomed generation, growing up in this period of a recession and a pandemic, predicting irreversible damage from climate change, AI replacing their jobs, this concern, am I going to have a job? Gen Z are reporting much higher levels of depression than previous generations. Fifth, lack of access, and we'll come back to that over the course of the day. Over 24% of individuals across our major healthcare coverage types, and that's Medicare, it's Medicaid, it's fee-for-service, it is commercial service, but over 24%, or about a quarter, had diagnoses for at least one behavioral health condition in 2021. Only 1 out of 3 of those individuals received treatment from a behavioral health specialist within the year. Cost is still a significant barrier. We know that cost, and if you talk to people, 1 in 4 adults report that with frequent mental distress, they could not see a doctor due to cost. Provider shortages, the providers who can reach out and help and connect with you are a huge challenge. Mental health provider shortages are present in every state in America. A great study out of MTSU's Jones College of Business just a few years ago estimates that in our state, an additional 17,000 mental health professionals across 20 occupations are needed in order to eliminate the provider shortage here in Tennessee. That's 17,000 mental health profession shortage. As we look at youth mental health, a report last year from the CDC identified substantial increases over a 10-year period in the percentage of high school students experiencing persistent feelings of sadness or hopelessness from 28% to 42%, considering suicide from 16% to 22%, from actually making a suicide plan from 13% to 18%, from attempting suicide from 8 to 10%. 1 in 5 youth had at least one major depressive episode in the past year. Over half of them, nearly 3 million youth, did not receive treatment. And of those who did receive treatment, only 65% said that it helped them. So across the board, the epidemiologic data has raised a red flag, ultimately leading the Surgeon General to declare a youth mental health crisis, and that was the U.S. Surgeon General's advisory of 2021. The Vanderbilt Child Health Survey in the fall of 2023 found that school performance, bullying, and mental health topped the list of concerns that parents have for their children in Tennessee. Tragically, Tennessee is in the top 10 nations for youth suicide by firearm. I'm optimistic about the future. You know, you say this, and I wanted to lay it out really as the scene setter because that's the reality. And we'll add to this over the course of the day and give it color. But wanted to give a fairly comprehensive reality check of where we are. So how in the world can we be optimistic? Well, I think many of you have met together over the course of the last year. You're looking at the resources and the tremendous resources that we see on the tables outside and upstairs. There is real reason for hope, real reason for optimism. And I'll tell you why personally, just from my perspective, and you'll have your own. At the end of the day, we'll be able to sort of wrap these together. First, and I'll just list 5, but telemedicine is dropping the geographic and financial barriers to care, to get that connection when people need care, the fact that we can do it in a safe, secure way that is remote. It connects people who are rural. It connects people who may have a stigma in terms of approaching a provider itself, and it is amazing. Obviously, the pandemic itself accelerated that. At the peak of the pandemic, telehealth represented about 13% of outpatient visits. That's in 2020. And before the pandemic, people didn't use it at all, less than 1%, but it went from 1 to about 13%. After the pandemic, mental health and substance use services by telehealth has stayed high, has stayed elevated, whereas other outpatient care for telehealth has really fallen off, and that's a good sign. It shows that it's working. It shows that it's useful. And the advantages are many. It makes mental health services more accessible, especially for people who live in rural communities. And I think where Tracy, my wife, and I have another farm where she grew up in Virginia, where the nearest health facility is an hour and a half away. To be able to be within a 30 seconds, either a Zoom or a phone call by telehealth that is licensed and appropriate has made a huge, huge difference. For homebound populations who just simply can't get in that van and may go drive an hour and a half and sit in a waiting room and then be able to see a appropriate provider, to be able to do that within minutes and make that contact in terms of the physical inconvenience, but also the anxiety and the stress. It helps patients avoid stigma and get the treatment in the privacy of their own home, where they're relaxed, where they're comfortable, in a setting that is much more secure to them than in a facility that they don't really know. Telemedicine has the potential to reduce the cost of care. All of that brick and mortar expensive transportation of the building itself and the back office and all the administration goes away with telemedicine. And it also, I have to say anecdotally, that it is so powerful in terms of the satisfaction after people have that experience and they move from that experience and they can have a follow-up that is easy and they know and can anticipate somebody will be there and they're there within reach, makes a huge, huge difference. I think there's so many things we can talk about. I don't want to go through them all, but I think on the hopeful side, I do have to mention artificial intelligence, and I'll click off some others here shortly. The artificial intelligence world is full of promise, and in the healthcare field where I spend most of my time today, people say, well, AI is going to cure this and it's going to cure that. I really do feel, and I'm almost convinced, I'll say with 99% certainty, AI is going to make a huge difference when we look at things like workplace shortages in healthcare, and in particular, mental health. AI and mental health care services serve as this sort of, in my mind, a workforce multiplier. And these AI-based tools have the potential to rapidly and inexpensively or relatively affordably, in many ways, multiply our mental health workforce, the shortage that I was just talking about. AI-based interventions, once trained, can directly provide the care, particularly where there's stigma around certain diagnoses where that stigma does exist. AI can work around that. It can enable healthcare the workers themselves to practice at the very top of their license, and can provide the sort of things like decision support that they will have access to in real time to be able to provide that particular person or that particular patient. There will be little prompts about if a question comes up, what is the very next best question to ask in order to lift that patient up? And that's the sort of thing that this pooling of what's called generative artificial intelligence, where you're taking these big learning models and putting lots of data for thousands and millions of people in, what's worked best for them, and then personalizing it with that individual provider and that individual patient. AI, I think, secondly, will improve the training, hiring, and ongoing quality assessments. Training and certifying mental health providers. And psychotherapy typically involves taking these videos. This is probably too much information, but you're taking these videos from a patient, all this privacy protected, a patient and somebody who is learning this whole, whether it's cognitive questioning and talking and discussing, and then looking at them over hours and hundreds of hours and seeing were the right questions asked. Based on that particular response, did you go in a certain direction? Well, that right now takes a huge amount of time. And what AI will do is cut through that and cut that time down from 10, 9, 8, 7, 5, 6, 2, 1 minute itself based on the experiences of so many others. AI, thirdly, can provide a companion to help address loneliness. Yes, you have to be careful, but if you are lonely and there is nobody, and you have an adequately, appropriately, medically, behaviorally trained interaction, there's a huge opportunity there. And fourth, AI can reduce the administrative burden. It's just hard to do all this. You have this back office, and some people have insurance, some don't. You have to register, you have to fill out a clipboard. AI can address that. A third area, as we look out in terms of being hopeful, firearm safety. And this is an interesting one because it starts as a very partisan issue. When you talk about firearms, a lot of people politically, the world that I've spent a big chunk of my life in, just gravitate to a firearm. It's the Second Amendment, or it's deniers, or it's not that big an issue, or it's my rights, or it's the Constitution. Now that it's a public health issue, that it is the number one cause of death of people 18 years of age and under, it kind of strips away all the politics and all the partisanship out there. A lot of this came from a policy problem where politics started. There was an amendment called the Dickey Amendment, too much information now, but it is interesting because we haven't had much data in terms of things like, why. What can we do? What levers are there? What is the evidence based on if we take a certain action? Background checks, do they work? Locks on guns and locking guns up, does it work? Well, people say, give me the proof. Well, this amendment we had, and it lasted probably 15 years, basically said it was illegal for the United States government to put money into research behind firearm safety. It came out of politics. It just didn't make sense. It sounds crazy now. But it was not until 2018 that amendment was lifted. And now it is legal for our federal government to support research into firearm safety around your kids and the next generation. And that's why policy matters. That's why voting matters. That's why most of you probably already voted. We need to get out and vote. Policy makes a difference. We're seeing a shift in the conversation today. People are coming to the table and talking about it as a public health issue. What can be done? They want that data. The data is beginning to flow. The conversations are beginning to flow. There's a fantastic group that emerged just several years ago called Voices for a Safer Tennessee. I'm on the advisory board there, and it's gotten traction. It's getting traction, and we're starting to see some incremental wins coming out of this past session. And you say incremental wins, yeah, but bad things are still happening. It's a slow process of education, but we can accelerate that process coming in. Something that you say, okay, what kind of wins? Things, we're not making progress in Tennessee, but we are. Voices for a Safer Tennessee put the spotlight on the fact that we had, in terms of background checks, and everybody says background checks make sense, whether you're Republican or a Democrat, or wherever you are, independent today, but we had a $761,000 backlog of background checks in Tennessee at that point in time, that people were not addressing. So where Voices shined a light on that money was made available, that backlog, you get rid of that, and those background checks are made so that people, yes, you still gotta have a firearm, and you can use those firearms, you can hunt, whatever, but you want those firearms in people's whose hands are safe. So these incremental advances are being made, and I encourage people to come to the table and have the discussions. It's a public health issue today. It's no longer a political issue. There's good news. I mentioned climate, and climate is one of these issues today that it can also be political, and you can see I get involved in all these potentially political issues, trying to bring some sort of rational sense to them. And the climate change is real, and we feel it, and we live it, and people are dying, and it's affecting our heart and our kidneys and our lungs and our mental status coming in. Well, progress is being made. Yesterday in the panel, brought in a guy from Louisville, Kentucky, who oversees a NIH program called the Green Heart Program. And what that program demonstrated is that by being proactive, and in this case, it was interesting, he had the first clinical trial, not of a drug and a disease, but it was trees and greening. And what they asked a fundamental question: does greening, planting shrubs and trees in appropriate places, actually affect the body? We feel like it does it? And what they've demonstrated by measuring, again, a medical thing, too medical, but C-reactive protein, which shows inflammation in the body itself, that by appropriately planting trees and greening a neighborhood, that you can reduce that from anywhere between 10 and 20% in the body itself. That inflammatory response, as I opened with, is what gives you heart attacks. It's what gives you asthma. It's what gives you depression, anxiety, waking up in the middle of the night. So for the first time, we've shown not just a drug, or yes, I guess a drug, using trees as a drug, demonstrably, with proof, with evidence, can actually lower that inflammation and then ultimately lower all sorts of things, whether it's a heart disease or lung disease or kidney disease or the various cancers out there. So there's hope. There's hope in science. There's hope in study. I'll give you just another example. In this whole area of climate, the Nature Conservancy that the mayor mentioned that I'm very involved with, we can do things at scale that could not be done in the past. All of us, most of us, many of us will compost, do our local things, make sure that we do as little as we can in terms of litter and waste and all. But there are also things happening at scale that were unheard of 5 years ago, 10 years ago. And what we have are things called nature bonds, where actually reduce sovereign debt of a country if that country invests in conservation measures. And it might be in forests, it might be in trees, it might be in coastal reefs, it might be in cleaning up streams. And in the Seychelles, $500 million put into conservation through these savings. And in Belize, $300 million going to conservation that makes a difference at scale. So today we can go at scale in addition to the individual efforts. Fifth, our communities hope, and lawmakers are taking this seriously. And all of you in the room would not be here. You are probably the best evidence of that. The fact that you're having this conference, you're having this discussion today, it's a testament to all of that. In addition, things you might or may not know, Governor Lee established a $250 million mental health trust fund for Tennessee youth. Take it up to the federal level, major bipartisan legislation to address opioid addiction nationwide was enacted by Congress 4 years ago in 2019, and the year before that in 2018. A significant amount of funding that goes directly to the states to address the crisis. And sixth, individually, we can make an impact. We talked already about social connection and the importance of social connection. We all, if we just think about it as I'm talking, have a loved one right now who's going through a tough time, or a friend who's going through a tough time. All day long, these thoughts come up, at least in my mind, and I say, gosh, I'm thinking about them, and then I move on, and maybe I'll send them a text, maybe. It'll say, thinking about you. What I would say, we need to go one step further to really get that connection there. We need to take out our device, and we need to use the telephone in that device and basically say, listen, I'm here. You don't have to solve the problem. You don't even have to, sometimes it's hard to even talk about the problem. It's that phone call and that you care that makes a difference. Operation Stand Down here in Nashville, which helps veterans address in Middle Tennessee, in Clarksville, in that area, address this transition to civilian life. Great advice. They encourage what they call buddy checks, where you have a friend you regularly check in with, and what they have found and demonstrated is it is a hugely effective tool in improving veteran well-being and specifically helping with suicide prevention. So with that first step today, let's all go out as we think about it, and maybe not in the middle of the conference itself, don't leave and make the phone call. You can jot it down, but afterwards do make that phone call to a friend, to a loved one, to somebody you just haven't connected with in a while. I'll guarantee that you will feel better. So that's kind of it. That's the scene setter for today from my standpoint. And I very purposely laid the menu to set the table with the reality of where we are today. Tough data, and we'll add more local data over the course of today. But you'll also see, for the 6 reasons I mentioned, I am hugely optimistic where we are. There are things we can do today, and it's in part because of technology and the computing and our devices, our ability to reach out and communicate that we just didn't have 10 years ago. We reach people locally and at scale we just couldn't do 10 years ago. And that's where much of this optimism and this hope comes to. And I'm absolutely convinced we can turn this huge ship in a powerful way by doing exactly what we're doing today, sharing ideas, listening to the panel, picking up things that by themselves you say, well, aren't that important, but in a dialogue, all of a sudden, oh yeah, I can relate to that. That's something that I can do. So with that, thank you very much. It's great to be with you today. Appreciate it. I'll be happy to take a couple of questions. I want to go to the next panel. Next panel and sort of start coming up. Any questions at all? And I probably don't have the answer, but I'm a good enough politician no longer that I can shift it to the mayor if I need be. Yes, and we do have some microphones as well, so feel free to introduce yourself as well.
So my name's Karen. I'm a citizen. I have a son who has struggled significantly over the last few years. My question for you is, you stated the lack of connectiveness, which I agree with you, but how does telehealth and AI solve that problem when it's connection that is going to solve substance use and solve mental health to a certain extent? You don't get that connectiveness through a computer screen or through the telephone.
Yeah,
Beyond prescribing a pill, which I can tell you right now that that's not the answer, how is that going to solve our problem?
Yeah, I think you hit right at the heart. I think the connectedness takes that interpersonal dimensions that we haven't studied fully, we don't even know, but to connect. And as a physician, if I'm going to do your heart transplant, I can tell you I'm not going to do it over video. That it takes the 6th dimension, the 7th dimension. It takes the empathy. It takes the feeling. It takes the touch in many cases, and that's a room that I operate from and have operated from my whole adult life. I will say, for you to get to the point where I can have that connection, if it weren't for technology, and you live 3 hours away, and you don't have access to a physician or to a diagnosis, and you can't get it. You don't even know it's there. It's a barrier of communication, of reach, of access. You got to look at cost, you got to look at quality, you got to look at access. So I think most of the use for like the virtual end of it is to improve access, to bring people into the system who might not otherwise get the care. So I think you're exactly right in terms of the ultimate. But I think it's equally important not to turn it off and say, no, that's a tool I don't need. Because right now, when you look at the statistics, we're reaching 1 out of 1/3 of the people who have the diagnosis. We're just even reaching them, and even that care is not sufficient itself. So we need to get people in the pipeline. The question on AI, I think, is also a really good one, because artificial intelligence, as I mentioned, is being built as sort of the end-all and be-all. And I gave you sort of the 4 reasons that I think AI is really good. And it is to help that individual provider, so that 1/3 of people, or 65% of people, basically say that the care you gave me wasn't that good. We got to make that care better. We got to empower that caregiver. What questions should they be given the profile of that individual coming in? Artificial intelligence can take the collective wisdom of hundreds of thousands of people and give that individual provider the three best questions to ask, not how are you doing or, how are your parents or how are you being treated, because they may not be the questions that are there. And that's the kind of tool that is magic. It brings wisdom together, it brings knowledge together. It does take these large learning models that you have today. So I take the essence of your question being, well, those are pretty good, but that's not going to do it. But they are going to do a lot in terms of getting people into the system of empowering providers themselves, I believe, coming forward. Not the end-all and be-all coming in, but great question. And any comment, you want to comment further on that? Because I think, obviously, you asked a question.
I mean, I think our culture has very much become driven on prescribe a pill and shove somebody out the door.
Yeah.
And so,
Yeah.
and I'm a nurse. I practiced for years, and that's the way our culture is.
Yeah.
It's a quick,
Yeah.
and what I've learned with mental health is it's never over, and it is something that we were told repeatedly we have been through hell with our son.
Yeah.
And we were told
Yeah.
as he gained, this has nothing to do about the medications. The medications are a sideline. It is all about getting to the root of his struggles.
Mm-hmm.
And it was changes that my husband and I had to make at home and our family had to make at home. And it was we've been working our tails off for over a year now. And we've been told that we need to keep going. But really, it's the medication is just, everybody believes that that's the fix, and it's not.
No, I think,
And so, to me, if you're using telehealth, I've done telehealth even non-mental health, and you don't have that same
Yep.
level of, and that is what's needed. So I
agree
with you that
yeah,
helps with
yeah.
rural health, but I think
Yeah.
that's not going to address the full problem. I think
Yeah,
we're fooling
I agree.
ourselves.
I agree. Very well said. And obviously, we'll hear a lot about the challenge that we've had, and your particular challenge. Obviously, we all feel no way to really feel that coming in. But that's why we're here today. Okay, yes, sir. Ken.
I'll ask you a question.
Oh, no.
And,
Okay.
You spoke of the politicization of firearms and the initiative to raise awareness that it's a public health issue. Can you expand on that just a little bit? And also, we have a lot of interesting research going on in Williamson County and Franklin at the Warren Center at Vanderbilt, the Life Sciences Center there, about a lot of the research they're doing on the chemical reactions in our brain. So if you'd make a comment about that too.
Yeah. And the first one, could you take that microphone and give it to the woman? I don't know her name, just sitting in the front there. That woman there is Erin Rogus, and I turned to her because she's really helped lead voices for a Safer Tennessee, but more, we work together every day. But are we making progress? Talk a little bit about where you see things are on this whole firearm safety and thing. Remember, right now, when you look at this intersection of mental health and physical health, that the firearm safety is the number one cause of death in Tennessee.
Thanks, Senator. Hi, everyone. I'm Erin Rogus. I'm Senator Frist's policy advisor. I also serve as policy director for Voices for a Safer Tennessee. And on the mental health component of firearm safety and injury and death, firearms actually in Tennessee, the 52% of our firearm deaths are actually suicides. So there's a big mental health component to, unfortunately, our firearm deaths and why we're seeing the increases. And as Senator Frist mentioned, we've seen an uptick among youth in particular. We're now in the top 10 states for youth suicide by firearm, and that is, because it's an access issue, in large part. We're having individuals who, with youth, they're predominantly finding firearms in their parents' home that are unsecured. And then in, older populations, it's then that easy access. One of the things Operation Stand Down said is if you can delay access by, as little as 10 minutes, that can actually save a life. Because with suicide, it's often a much quicker decision than people realize. You think there's something they've been planning out, but it's really that moment of true despair. And, a week later, they may not be feeling quite as emotionally distraught. But if they have access to a firearm that minute, it can be the difference between life and death. One recommendation if you are a firearm owner is to include in that space where you store your firearm, hopefully securely in a lockbox and a locked cabinet, pictures of the people that you love. Why are you here on this earth? Is it your children? Is it your dog? Is it your spouse? Who's going to really miss you if you're not here? That helps remind you, to stay here. As far as progress we're actually seeing, there, as Senator first mentioned, it is gradual, but you're seeing a shift now where in conversations we're having with legislators, they recognize that we need to be doing something different. No one wants this to be the number one killer of our children. But we have to meet them where they are and be willing to celebrate those incremental wins, because without incremental steps forward, we're not actually going to get to the bigger wins long term. Some of the things that happened quickly last session, I don't want to take up too much time. I can take just one more minute just to tell you. Okay, terrific. And so just some of the things that happened last session, as Senator first mentioned, we have a 761,000 record backlog in our background check system. We are not going to be able to actually have sound background checks if we aren't even getting the records in there adequately. So we helped secure additional funding to get 5 additional TBI staff members to process those records, so our background checks are actually working. So we're able to deny firearm sales to those who should not, who should be prohibited purchasers. 2, passed a law called HB 1600. What this bill does, it's actually kind of the first time in nearly a decade that Tennessee has actually kind of restricted firearm access. We've gone, obviously in one direction. We've really loosened our laws over the past decade, notably, but this is kind of the first time in a while we've restricted it, and it was for juveniles who have who've been adjudicated of violent crimes or have been committed for mental health reasons. So now going forward, if you have that as a juvenile, that violent adjudication, or you've been committed for a mental health reason, you are now prohibited from purchasing or possessing a firearm until age 25. And this is important because 18 to 20 is the age that is most likely to commit a firearm homicide. So they are kind of causing some, unfortunately, that disruption in the community for community safety. It's also an elevated risk of suicide, as Senator first mentioned, for that youth population. And additionally, they also passed legislation, Jillian's Law, which you may have heard tragically about, the Belmont University student who was shot and killed. She was killed by an individual who'd had a history of violent crime, but had been deemed incompetent to stand trial. So he was released, and got his hands on a gun and accidentally, I don't know what his intentions are, but ultimately, killed Jillian Ludwig. This law, now for those individuals, they will now be added to the background check system. So they will, if you've been deemed incompetent to stand trial, you're now a prohibited purchaser. And you'll also, instead of being released to the streets, if you've got a violent history and are incompetent, you will now be placed in a treatment center, and they will try to restore competency before proceeding with the trial. So there are some steps being taken. These are smaller steps, certainly, but it does show that, the legislature is actually kind of willing to work on some of these issues. And, Mayor Moore, if there are things that you're seeing in Franklin and Williamson County that could be addressed with additional policy changes, we would love to hear it that you all are seeing, because we do think those small changes are the way to actually, lead to long-term progress.
So you see why we stay really hopeful, and we're in the policy world, and hopefully they give you some hope that no matter how big these issues are, how political they are, how people result to slogans, that we can make huge progress in mental health and behavioral health. And that's what you're about today, to talk about the tough things, but also keep that hope out there, because it's absolutely clear to me that we can make huge progress as we go forward.